Dr. Kashyap with Gallery of Women's Health, and welcome to our Journey to Health educational series. Today we have Dr. Gautham Reddy with us. Thank you for your time.
Thank you for having me.
Dr. Reddy is an internist. After completing his residency and internship, he has been in this town for more than a decade. And he practices in the Anthem Health Medical Center. That's its practice. And we are very thankful to him for spending his time here and answering some of our questions.
Thank you for having me.
I want to ask you, especially in the current times, what do you mean by immunity?
So immunity is it's a broad word. It definitely is made of many things, including some cells that are called white blood cells. You have organs, which is your spleen, your thymus gland, and the big picture of immunity also I want to emphasize is your digestive tract. And there's so many lymph nodes from your esophagus all the way to your lower colon that is lined by lymphatic tissue, and a lot of what we put in our body kind of is the end result of what our immune system will be. So let's say you fill the digestive tract with a lot of sugar, you're going to attract more infection. That's why diabetics get more infection. So,
right. And in these times, what can people do to actually build up that immunity so that they're able to fight it?
Right. Well, winter is coming, and we're also in the pandemic. So, a very good idea for everybody to do is not just sleep well and exercise and eat right, but some of the key supplements you can do on a daily basis is vitamin D, which is number one, vitamin C, and zinc. They particularly have good protection against viruses, which we're dealing with one right now. So I've been instituting that the last 6 months, and we've had very good results in our clinic and our practice. We've had nobody go to the ICU. We had 0 deaths in my practice that we've treated. So there is a big role to play, being proactive and reactive on this.
Okay. Yeah, you mentioned vitamin D. Can you tell us a little bit more about vitamin D?
Yeah. So vitamin D, even though it's kind of classified as a vitamin, it is more of a steroid hormone to the body. It's absolutely essential to the human body. There's 3 species that can't survive without it. At least as far as optimized health, you have your plants, which are sun dependent. You have your reptiles, and then you have your human beings that are very dependent. Not all animals are D dependent. Most of the species that I just mentioned, they usually have a lifespan up to 100 years, and all the longevity species on Earth seem to be sun dependent. So that's a very unique characteristic that we, as part of the whole ecosystem, are kind of similar to that. And as far as clinically speaking, it's a very common problem. A lot of people are D deficient. Many reasons are there. One is your personal skin type. Second is what part of the country you are. Once a winter do you have? How much clothing you wear? So a lot of those affected are very varied in race and geographical location, and also prolonged winters. Most of those populations are D deficient. So you really got to look at what you're doing, what your lifestyle is, how much clothing you wear, and what your skin type is. Most darker skin patients have even lower levels because it takes a lot more time to absorb vitamin D even through sunlight. So sunlight's great, but I don't rely on it. I personally just advise everybody to take at least an average adult to take about 5,000 units a day, and that usually does the job.
Okay. Yeah, we live in Las Vegas and we have so much sun, but still I see the same thing. A lot of people are deficient in vitamin D.
Right. So it's really got to do with how much exposure in the sun, even though you're hot, but if you're in a building with air conditioning at 72 degrees, you're not getting
That is true.
So,
and what about vitamin C?
So vitamin C has many different functions, but in this context, it has been beneficial for bacterial and viruses. You can actually use high doses during infection. You can have maintenance doses of 1,000 milligrams a day for an average adult. But all the COVID patients, we try to give them about every 8 hours a dose because that's how much bioavailability it has. So if you take it 3 times a day, you'll get 24-hour coverage of vitamin C during any infection. That's a good way to optimize your levels.
Okay. And you also mentioned zinc.
So zinc is a very unique mineral. It has immune properties, and it has a lot of benefit, especially with this COVID-19 virus. It's one of the it's a viral killer, and in the news you've heard the drug hydroxychloroquine mentioned. And hydroxychloroquine is not an antiviral by any means, but all it does is opens the zinc channel. So when the zinc channel is open, the zinc it goes inside, and zinc is the one that actually kills the virus.
Okay.
Hydroxychloroquine is just a conduit of entry.
Okay. I see a lot of younger patients and people who are coming to me, they don't see their primary care or they don't have a primary care doctor. And I always tell them that, once you're a certain age, it's important to have a primary care physician for even if you're not sick or you don't have any problems. Can you expand on that a little bit?
Yeah. So, I think that's true. A lot of young patients go long periods of time without seeing a doctor if they're healthy. That's fine, but the recommendation is at least at age 35 is start to get annual physical, including blood work. Blood work is probably mandatory at that age to make sure your cholesterol, your thyroid, and other organs are optimized. And also, that visit will include cardiovascular check and including the blood pressure. So it's a smart, maintenance thing you can do, just like your car.
Yeah. That's the whole point, that right now when actually you're not sick, you don't have any problem, that's the time you want to get in and find out problems that have not gone to the disease stage.
Correct.
Right?
Correct, yeah.
So,
that's kind of what we do. We basically, look at each person's risk type and see what their family's medical problems are. That will kind of get better information about how we approach your personalized care, because whether it be diet strategy, medications, supplements that we at our clinic are very focused on nutritional health. We have a full-time nutritionist there that guides a lot of nutritional strategies for common diseases, so you don't have to have a feeling that the first approach to a medical problem is medication. So we try to give people options of how to remedy their body so they optimize their health without medication. So that's kind of one of the emphasis that I've been focusing on the last 10 years, is to give people other solutions to add to their current medicines, or even to taper off their medicines. Many patients have done dramatic lifestyle changes and they're not diabetic. So all is possible. We just are trying to give you the tools to optimize yourself.
Thank you. That's very interesting. Because a lot of people rely just on medication, and I agree with you. It's a more holistic approach where we can use.
Yeah.
And I know you do a lot of integrative medicine.
Yeah.
Right?
Yeah.
So, apart from nutrition, do you use anything else in your?
So we use various supplements for mental health. We, one of the genes that I'd like to probably, talk about with the audience is the gene called the MTHFR. That gene has an association with cardiovascular diseases, psychiatric problems, autoimmune conditions. And if you look at those 3 diseases, they're very genetic. Most people who have those, they have family members that have similar. And this is the gene that's kind of responsible for that. So we can not only check for the gene and also teach you how to neutralize the gene. And knowing your genetics is one thing, but epigenetics is a new up-and-coming field that kind of teaches how to optimize your genes to optimize your health, and that's epigenetics. So when you're methylating yourself for that gene defect, you're kind of reversing the defect completely. So
this is so interesting. I feel I can just go on and on and on, but we are short on time. But thank you so much for all the information.
Yeah.
And I really hope. I learned a lot, and I hope you find all this information interesting. And if you have any questions, you can always reach out to us or to Dr. Reddy. He's with Anthem Hills Medical Center. And thank you. Take your vitamin D, vitamin C, multivitamin, and stay strong.